MARFAN syndrome is a genetic disorder. Look at this picture, shows that signs and symptoms: cardiovascular defects, aortic aneurysm, then echocardiogram findings. Look at this: MRI, aortic dilatations, look at this, a detail going on. Introduction. MARFAN syndrome is a genetic connective tissue disorder that affects multiple organ systems including cardiovascular, skeletal, ocular and endogenematary systems. It is named after Antoine MARFAN, who first described in 1896. This condition is associated with a range of physical characteristics and medical complications, some of which can be life-threatening if left untreated. Etymology. The term MARFAN syndrome is named after French pediatrician Antoine MARFAN, who first described the condition in 1896 when diagnosing a young girl with characteristic skeletal abnormalities. A definition: MARFAN syndrome is a genetic connective tissue disorder caused by mutations in the FBN1 gene, leading to defects in the fibrillin 1, a protein critical for structural integrity and elasticity. It primarily affects the cardiovascular, skeletal and ocular system, often presenting with life-threatening complications like aortic aneurysms. Types. While MARFAN syndrome itself does not have subtypes, individuals with conditions may present with varying severity of symptoms. This variability is influenced by the specific mutation and other genetic or environmental factors. Causes: 1. Genetic mutation. A mutation in the FBN1 gene lead to defective fibrillation. 1. Protein disrupting connective tissue integrity. 2. Inheritance. In 75% of cases, the mutation is inherited from a parent with MARFAN syndrome. 3. De novo mutation. About 25% of cases arise spontaneously without a family history. Risk factors: 1. Family history. Having parent with MARFAN syndrome increases the risk. 2. Genetic predisposition. Specific FBN1 mutations may predispose individuals to more severe manifestations. Complications: 1. Cardiovascular, aortic aneurysm, aortic dissection, and mitral valve prolapse. 2. Ocular, lens dislocation, myopia, glaucoma, and retinal detachment. 3. Skeletal, scoliosis, chest wall deformities, and joint hypermobility. 4. Respiratory, pneumothorax and obstructive lung disease. 5. Neurological, dural ectasia. Pathophysiology: fibrillin 1 is a key component of microfibrils in connective tissue, which provide strength and elasticity. A defective FBN1 gene leads to abnormal TGF beta signaling, causes overgrowth of tissues and weakening of connective tissue. Structural weakness leads to issues such as aortic dilatation and dislocation of the lens. Step-by-step pathophysiology of MARFAN syndrome. 1. Genetic mutation. 2. Defective fibrillin 1 production. 3. Altered TGF beta regulation. 4. TGF beta overactivation. 5. Weakened connective tissue. 6. Organ specific manifestations. A. Cardiovascular, weakening of aortic wall leads to dilatation, aneurysm formation, and risk of dissection. Mitral valve prolapse may also occur. B. Skeletal, overgrowth of long bones and joint hypermobility due to abnormal connective tissue. C. Ocular, loss of structural support causes lens dislocation and predisposes to myopia. D. Respiratory, reduced elasticity in lung tissue contributes to pneumothorax and other respiratory issues. 7. Progression. By targeting both the structural and regularity dysfunctions caused by fibrillin 1 abnormalities, modern therapies aim to mitigate the systemic effects of MARFAN syndrome. Signs and symptoms. 1. Skeletal, tall structure with disproportionately long limbs and fingers, scoliosis and joint hypermobility. Pictus exorbitum, pictus cornutum. 2. Cardiovascular, heart murmur, enlarged or weakened aorta, mitral valve prolapse. 3. Ocular lens dislocation, severe nearsightedness. 4. Skin stretch marks not related to weight gain or loss. 5. Respiratory shortness of breath due to lung problems or scoliosis affecting breathing. Diagnosis. 1. Family history, assess for hereditary patterns. 2. Physical examination, evaluation of skeletal, ocular and cardiovascular features. 3. Imaging, echocardiogram, MRI to detect aortic dilatation. 4. Genetic testing, confirmation through FBN1 mutation analysis. 5. HYGIENE criteria, diagnostic framework that combines clinical findings and genetic testing. Nursing diagnosis. 1. Risk for impaired cardiovascular functions related to aortic dilatation. 2. Risk for injury related to skeletal abnormalities and joint hypermobility. 3. Impaired vision related to lens dislocation. 4. Anxiety related to chronic illness and potential complications. Management. First, medical management. 1. Medications. Beta blockers reduce stress on the aorta. Angiotensin receptor blockers, ARBs, control blood pressure and prevent aortic dilatation. 2. Surgery, aortic root replacement for aneurysms, corrective surgery for skeletal deformities. 3. Lifestyle modifications, avoid strenuous physical activity, regular monitoring of cardiovascular and ocular health. In nursing management, 1. Monitor vital signs and signs of cardiovascular distress. 2. Educate patients and families about the disorder and its management. 3. Provide psychosocial support to address emotional and mental health needs. 4. Encourage adherence to medical regimes and regular follow-ups. Treatment options. 1. Pharmacological, beta blockers, ARBs and pain management as needed. 2. Surgical, repair of aortic aneurysms, scoliosis correction and lens surgery. 3. Assessive devices, braces for scoliosis or custom orthotics for foot abnormalities. Psychosocial medicine. 1. Counseling, address coping mechanism and emotional support for patients and families. 2. Support groups, connect with others affected by MARFAN syndrome. 3. Quality of life, focus on adapting to limitations while maintaining independence. Prevention. 1. Genetic counseling for families with a history of MARFAN syndrome. 2. Parental testing in high risk pregnancies to detect mutations. 3. Early intervention, monitoring and treating complications promptly to prevent progression. In conclusion, MARFAN syndrome, though a lifelong condition, can be managed effectively with early diagnosis, proper medical care, and supportive interventions. Multidisciplinary care is essential to optimize quality of life and minimize complications. Education and awareness are key to empowering patients and families to navigate the challenges of living with MARFAN syndrome. Thank you. Have a nice day.